Hi everyone, welcome to today's presentation. My name is Meghan and I am the sexual health nurse with the Bladder Cancer Supportive Care Program. Today's presentation is about managing the impact of bladder cancer treatments on sexual function and intimacy. This talk will run for about 60 minutes. First of all, I just want to thank everyone for joining me today. I want to recognize that this can be a time of many changes and challenges which can be emotional, physical, or psychological. Hopefully the knowledge shared today will help to empower you on your cancer journey. Today we will begin by talking about the program and the different services that are offered, and then I will go over the concepts of sexuality and intimacy. We will review what normal sexual functioning looks like, and then we'll talk about the impact that bladder cancer treatment can have on your sexual function and some different management approaches. So there will be a lot of information reviewed in today's presentation, and the degree of relevancy will depend on what stage you're at in your cancer journey. This is a general information session, so if you have specific medical concerns, those should be brought to your doctor or back to your healthcare team, or you're more than welcome to schedule a one-on-one appointment with me. Here is some information about the Bladder Cancer Supportive Care Program. We offer education sessions, clinical support appointments, and have a research component in our program as well to better understand the needs and treatment strategies for bladder cancer survivors and their partners. These are the different education modules that we offer. They are all offered either in person or through live online sessions. Most of these education sessions are offered every month and are associated with a clinic. So if you're interested in learning more about our one-on-one appointments or our group education sessions, please get in contact with our program coordinator, and they will get you connected with whatever service you want to be connected with. So in the Sexual Health Clinic, our goal is to provide education, supportive care, and medical and surgical therapy in order to enhance your sexual functioning, intimacy, and overall quality of life. Our program is located in Vancouver, but we do serve people from all around BC. Our lead physicians are Dr. Marie-Pierre Saint-Laurent and Dr. Ryan Flanagan in Vancouver, and we have also partnered with Dr. Melanie Altus for female sexual health support. Currently, the only way to access care is through our Sexual Health Clinic. So this is where you have one-on-one clinic appointments with the Sexual Health Clinician, and this is for both patients and their partners to discuss the impacts of treatment on sexual function and intimacy. You might have heard that treatment for bladder cancer can affect your erectile functioning. This can impact your sexual functioning, how you feel as a sexual person, and intimacy with a partner. Today, we'll start with creating some perspective with information about intimacy and sexual functioning. A lot of the information here will seem specific to those who are partnered, but it can still apply to you if you're single and also if you're interested in finding a new partner. We'll take a closer look at sexuality because there are many different components. Sex is something that we do, and sexuality is the essence of who we are as unique individuals. It's about how we express ourselves, what brings us joy, what brings us pleasure, and it encompasses all of the feelings, attitudes, and behaviors that contribute to our sense of self. This is the wheel of sexuality, and it shows the diversity of our sexuality, including elements of biology, psychology, and social influences as well. It is important to be aware of these components and how they may be impacted by your cancer experience. Having that awareness will help you as you go through the process of sexually adapting. Our values and beliefs around sexuality can be influenced by societal myths. Let's explore some myths in society that we've all heard. Number 1, people with health challenges have no interest in sex. This isn't true. People still have an interest in sex despite having health challenges. The next myth is that male orgasms require an erection. This is a very common myth. However, even with a soft penis, you can achieve orgasms. The next myth is that sex is for young people. This is definitely not true, and many people are sexually active until the end of life. The next myth is that good sex requires orgasm. You can still have a good sex life without orgasm. The process itself can still be enjoyable and pleasurable. Next, we have sex education is only for disease prevention. So we do commonly think of sex ed as being information about STIs, but sex ed can be for many reasons, including understanding sexual dysfunction and learning new ways of being sexual. The next myth is that sex should be spontaneous with no planning and no talking. However, sometimes sex does need to be planned, especially when you're using some of the devices that I'll talk more about later. The next myth is that sex means sexual intercourse. There are many ways to define sex. It can mean oral sex, touching, self-stimulation, etc. So there are a lot of different options. And then last but not least, men should initiate sexual activities. This is not true. Anyone can initiate sexual activities. It doesn't just need to be the man. So when you have a look at your own values and beliefs, it is important to recognize if they are influenced by these myths. If they are, and when you start to see changes with sexual health or function, that's when you might run into problems. These myths can serve as a barrier to exploring new opportunities. Next, I'll talk about intimacy. Intimacy is an umbrella term for that affectionate or loving personal relationship with another person. It's the sense of closeness that you feel with someone. There are multiple dimensions that make up intimacy, and it is powerful to share intimacy with another person. We'll focus on 4 primary intimacies. The first one is intellectual intimacy. So this is about how your minds meet. They are your shared interests, thoughts, ideas, and connection on values. Then you've got experiential intimacy. So this is closeness in terms of shared activities, what you do together that you enjoy. Then there's sexual intimacy, and this speaks to sexual practices that you share with a partner. And then there's emotional intimacy as well. So this is about how you support each other, the ability to be vulnerable together, and fostering those feelings of closeness and trust. For some, there may be spiritual intimacy as well. So as you can see, there are many ways of being intimate with one's partner, and it's important to communicate what dimensions of intimacy are important to you and how to maintain that closeness throughout your relationship. You'll notice that each bubble in the picture is equally balanced and they are all the same size. In reality, you may find that some of these bubbles are different sizes depending on what's important in your life. So as an example, the emotional bubble may be more important in your relationship than the sexual bubble, and that's okay. You get to decide how to share intimacy with someone. Now we'll explore what normal sexual function looks like. We will take a look at the sexual response cycle. So most people will start with having sexual desire and arousal. This is where you become sexually excited. And then an erection may occur, although as we reviewed with the myths, it's not necessarily needed. After the erection, you may arrive at orgasm or climax, which is usually coupled with ejaculation, a release of fluid. It's important to note here that orgasm and ejaculation are different processes. Orgasm is the peak of pleasurable sensation typically achieved after sexual stimulation, whereas ejaculation involves movement of semen out of the penis. The prostate and the seminal vesicles create 90% of the fluid found in semen, so when those structures are removed or damaged, then the amount of fluid will be impacted, or there may be no fluid at all. Lastly, you enter the resolution and refractory phase, where the penis becomes flaccid or soft, and another orgasm or erection is not possible for a period of time, and the recovery phase tends to increase with age. There are many factors that can affect each of these processes, and each process can directly impact another. Here are some factors that can affect the sexual response cycle. Lifestyle factors can include diet, exercise, excessive alcohol or drug use, and even sleep patterns. Psychological or emotional factors can include feelings of anxiety, depression, or stress. Medication and medical conditions can include diabetes, chronic pain, or high blood pressure. And sometimes people do not realize that medications such as hormones or antidepressants can impact your sexual response cycle, especially the arousal piece. If this is concerning, you can talk to your doctor because there may be alternative medications, but please don't alter anything or stop anything without talking to your doctor first. Sexual dysfunction can include any concerns or disruptions to your baseline sexual function. Age is a factor as well. A lot of people do experience changes to their sexual function with age. And of course, cancer treatment can have a big impact. For example, if there's injury to the cavernosal nerves, that can impact erectile function. Now we'll talk about how erections work. Erections occur from thinking sexual thoughts, from sexual touch, or during sleep. All forms of erections require a signal to be transmitted from the spinal cord to the penis through a set of nerves called the cavernosal nerves. These nerves send signals to the blood vessels, telling them to relax and to allow more blood to flow into the penis. You can see in the cross-section picture of the penis that there are two structures that look like tubes. These are the erectile bodies. Inside the erectile bodies, there are small spaces. They kind of look like sponge or Swiss cheese. When the smooth muscle in these cavities relaxes, the cavities expand and allow blood to flow in, forming an erection. Something important to note here is that normally people will have what we call nocturnal erections, which involves having 3 to 6 spontaneous erections per night. Most people are not aware of this happening unless they happen to wake up and notice that morning wood. So it's the penis's natural way of working out, providing oxygen-rich blood to the tissue for it to stay healthy. If you're not having sexual erections or noticing nocturnal erections, then you may need to engage in penile exercise or penile optimization to keep the blood flowing. We'll talk more about how to keep your penis healthy later on in this presentation. Bladder cancer treatment can cause erectile dysfunction, and this can occur in 3 processes. Firstly, the nerves that help to create erections can become injured. The muscle in the penis can become fibrotic or less healthy over time. And lastly, the arteries that bring blood into the penis can become damaged, which stops the penis from receiving adequate blood flow. So we'll look at each of these in more detail. First, we'll talk about nerve injury. The cavernosal nerves, which control erections, originate in the spinal cord and run along the back of the bladder and prostate before entering the penis. They are shown here in yellow in this picture. Since these nerves are very close to the prostate and bladder, they can be affected by bladder cancer treatment. So with surgery, which is called a radical cystoprostatectomy, the bladder and prostate are removed. If the surgeon is able to, they will try to spare the cavernosal nerves. This is called a nerve-sparing surgery. It's not always possible to spare the nerves, and this is dependent on the characteristics or the extent of the cancer. You can also have issues with erectile dysfunction even if the erectile nerves are spared. The nerves are very sensitive and can enter into a shock phase called neuropraxia. In that shock phase, the nerves aren't working anymore, and it can take up to 2 to 4 years for the nerves to heal and to come out of that shock phase. Studies report that 80 to 90% of patients experience erectile dysfunction after surgery, even with nerve sparing. It is not possible for us to predict how much healing will happen or when it will happen. Your body has the final say in terms of how it will recover. Next, I'll talk about radiation. Radiation eliminates cancer cells by directly destroying the cells or by damaging their DNA. For radiation therapy, while the bladder is being targeted, there is a smaller amount of radiation that reaches the cavernosal nerves. Some radiation reaches the cavernosal nerves, potentially impairing their function. Radiation can also damage blood vessels, supplying the pelvis, reducing blood flow to the penis. Around 40 to 70% of patients experience erectile dysfunction after pelvic radiation therapy. Next, we'll talk about muscle fibrosis. With surgery, which is once again a radical cystoprostatectomy, and with radiation therapy, both can cause the muscle within the penis to become more fibrous and less healthy over time. Around the penile muscle, there is this sheath of tissue called the tunica. And normally, when the penis fills with blood, the muscle expands and closes off the blood vessels against the tunica. This mechanism keeps the blood in the penis to maintain an erection. With the penile tissue becoming more fibrotic, it becomes less functional, so it doesn't have the same ability to expand against the tunica, which prevents blood from staying to sustain the erection, and this is what we call venous leak. So imagine you are going for a bike ride and you need to fill air into your bicycle tire. If the tire valve isn't sealed properly, no matter how much air you pump into the tire, the air will not stay in the tire and the tire will be soft. So it's the same concept with venous leak. You may have good blood flow going into the penis, but if unable to seal off the veins, the blood will return to the body, causing a flaccid or soft penis. Lastly, we'll talk about compromised arterial inflow. So to form a rigid erection, you do need to have good blood flow going into the penis. Surgery and radiation can damage blood vessels inside the penis, reducing blood flow and causing erectile dysfunction. This can limit the blood flow going into the penis, and if this occurs, you may require treatment to ensure your penis gets enough blood flow to stay healthy. In some cases, vascular damage can be reversible, and treatment options exist to improve penile blood flow. So I want to acknowledge here before we continue that currently there is little data on the impact of non-muscle invasive bladder cancer treatment on sexual health, so the information presented here is limited. For those that have non-muscle invasive bladder cancer, roughly 50% of patients will report some form of sexual dysfunction following diagnosis. So with that being said, I will review the changes that can occur after various bladder cancer treatments. For those who have non-muscle invasive bladder cancer treatment, you may have a transurethral resection of the bladder tumor, or a TURBT for short. You may also receive intravesical chemotherapy or immunotherapy. Intravesical means that the medication is placed locally into the bladder. If you have had intravesical treatment, you may be advised not to have sex for 1 to 7 days afterwards because there may be discomfort. To protect your partners from medication contamination, you may be advised to use a condom for sexual activity for the duration of treatment and for a few days after treatment. Your doctor will specify the exact time frames. So for a TURBT, the onset of changes can be immediate. For intravesical treatment, changes can occur shortly after treatment. Sexual drive is not directly affected by a TURBT, but it can be impacted by feelings of stress or anxiety. For intravesical treatment, sex drive is also not directly impacted, but it can be influenced by urinary side effects, such as frequency, urgency, or burning. It can also be influenced by fatigue, aches, and loss of appetite. Erectile dysfunction is not an expected outcome of a TURBT, but function can be impacted by discomfort or pain from the procedure. It can also be affected by urinary symptoms, anxiety, or fear of infecting your partner. It's important to remember that you cannot pass on bladder cancer to your partner. If erectile dysfunction does occur with a TURBT, it tends to be temporary, perhaps lasting a few weeks. For intravesical treatment, erectile dysfunction is usually temporary, occurring 36 to 48 hours after treatment, and is typically linked to urinary side effects. Erectile dysfunction can recover by 30 to 40 days after the last installation. For orgasms, there are no expected changes for either a TURBT or intravesical treatment. The same goes for ejaculation. And penile shortening is also not an expected outcome for either TURBT or intravesical treatment. For urinary issues, though, there can be potential bleeding, pain, burning with urination, and as mentioned earlier, there can also be frequency and urgency. For bowel issues, none are expected for either treatment. But for other side effects, for a TURBT, there is the potential for infection, perforation, or spasms. You would discuss these in details with your doctor prior to the procedure. For intravesical treatment, there can be fatigue, aches, or loss of appetite. The sexual side effects of a TURBT can vary depending on the length of the procedure, length of urethral catheterization afterwards, or any procedural complications. I also want to note here that the effects are not too dissimilar for cystoscopy. There can be a temporary decrease in libido and erectile function. For a cystoprostatectomy, the onset of changes is immediate because the erectile nerves will be affected either from surgical removal or from temporary damage from the surgery. Sexual drive is not directly affected. Erectile dysfunction, as mentioned, is typically immediate. Most people experience it for at least 6 months, and healing can take up to 2 to 4 years. For orgasm, some people find that orgasm is the same after surgery. Some say that it's different, but still pleasurable, and some say that it's better. There is the possibility of pain with orgasm, but this tends to be temporary and could be due to muscle spasm, and the pain generally decreases over the first year of healing. For ejaculation, there will be no ejaculate because the prostate gland and seminal vesicles have been removed with the surgery. People report different experiences with dry orgasm. Some describe a more intense orgasm, while others feel that orgasm is not as pleasurable. The Cowper's glands are not affected by surgery. Therefore, you may notice pre-cum or pre-ejaculatory fluid, which is still present, and it's a clear and stickier fluid. A lot of people report penile shortening and shrinkage following surgery. There are a number of factors that may contribute to this, including scar tissue formation, reconnecting of the urethra to the neobladder, and damage or interruption to the blood supply of the nerves. The reasons for penile shortening and shrinkage are not yet fully understood, but the length is sometimes restored by 1.5 to 2 years. If you have a neobladder, there may be urine present with orgasm after surgery. This is called climacturia, which is the release of urine at climax or orgasm. Urine is considered clean. As long as you don't have an infection, it won't be harmful to you or your partner if urine gets in or on anyone. Climacturia can improve in the first 6 months after treatment. If there's no improvement, or you have any questions or concerns, you are welcome to attend our education session called Pelvic Floor Physiotherapy for bladder and bowel concerns. For the bowels, there can be diarrhea and flatulence for those who have a neobladder, and this can potentially be long-term. For other concerns, there can be changes to body image if you have a stoma created. This is common and can impact sexual experiences. People navigate body image issues in different ways, including using an opaque stoma bag or a stoma cover. If this is an issue, you can talk to the nurse specialist in wound, ostomy, and continence. Next, I'll talk about radiation therapy, which uses a linear accelerator to destroy the cancer cells. The onset of erectile changes is typically gradual, with decline potentially starting after completion of treatment. Sexual drive is not directly affected, but it can be decreased from stress, anxiety, or fatigue. Erectile dysfunction, as mentioned, does occur gradually, and changes are generally noted 1 to 3 years after treatment. For orgasm, there may be some short-term pain or difficulty reaching orgasm. For ejaculation, sometimes there is decreased ejaculatory fluid, sometimes it's completely dry. Penile shortening is not an expected outcome. There can be urinary issues, though. Due to bladder irritation from the radiation, there can be frequency, urgency, or blood in the urine. For the bowels, the rectum is a nearby structure, so there can be bowel side effects like diarrhea or bleeding from the rectum. And there can be other side effects as well, such as skin irritation or fatigue. Next, I'll talk about systemic treatments and immunotherapy. Systemic treatments for bladder cancer, such as chemotherapy and immunotherapy, can have varying effects on sexual function. While these therapies do not directly damage the cavernosal nerves or structures responsible for erections the same way that surgery and radiation do, they can still contribute to sexual dysfunction through systemic side effects, hormonal changes, and overall health deterioration. For the onset, for chemotherapy, changes can occur weeks to months of starting treatment and can persist for months to years afterwards, depending on the drug and recovery. For immunotherapy, effects can develop gradually over months to years, and they're often related to chronic inflammation or autoimmune side effects. Sexual drive can be affected by pain, fatigue, nausea, or general malaise. For chemotherapy, some people may have decreased libido, which can lower sex drive. For immunotherapy, immune-related side effects such as thyroid dysfunction can lower libido. For erectile dysfunction, for chemotherapy, erectile function can be affected by blood flow, changes to sensation, and about 20 to 50% of patients report erectile dysfunction with chemotherapy. For immunotherapy, this can be affected by impaired thyroid dysfunction, which is a known side effect of checkpoint inhibitors and can include fatigue, low mood, and low sex drive. For orgasm, with chemotherapy, reduced sensation or difficulty achieving orgasm occurs in about 30% of patients. As well, fatigue and overall health decline may reduce orgasmic intensity. For immunotherapy, orgasm is rarely directly affected, but chronic inflammation can cause changes to sensation over time. With ejaculation, for chemotherapy, there can be decreased volume. For immunotherapy, there are rarely any direct effects. For penile shortening, there is no direct impact. For urinary issues as well, there's no impact expected unless you get an infection. And then for bowels, with chemotherapy, there can be diarrhea or constipation, which can in turn affect energy levels and libido. For immunotherapy, there can also be diarrhea. And there are other side effects to consider. There can be fatigue, chemotherapy-induced nerve damage. Testosterone can be generally impacted by both treatment options. And there's the psychological impacts as well, such as depression, anxiety, or body image issues. The idea is that if you have good pre-treatment erectile function, the better chance you will have good erectile function post-treatment. Age is an important factor, as erectile dysfunction is a normal aging process. Younger patients may have slightly less impact or find that they recover quicker. It's important to consider your pre-existing medical conditions and the type of cancer treatment you've had. And remember, no matter what factors are involved, it is your body that has the final say on how it will recover. In the meantime, it is important to be proactive in supporting your recovery. It's also important to know that despite many challenges and barriers to overcome, you can still have a good sex life after bladder cancer treatment. Many couples have a pattern of being sexual. There's nothing wrong with having a pattern. It's something familiar and it leads to a pleasurable experience. Bladder cancer causes a change in the pattern of how you make love. We like to think of this as an opportunity to redesign your sexual life, to think of new ways of being sexual that were not thought of before because you had a pattern in place. So how do we move forward or go about managing this? We will take a look at some approaches for managing sexual changes after bladder cancer treatment. You can work with your sexual health clinician and schedule a one-on-one appointment. If you have a partner, we encourage them to attend as well. Over the next few slides, we will talk about communication, adaptation, and the different therapies for enhancing erectile function. The most important way to improve your connection is through communication. By maintaining an open dialogue, you can ensure that each of you are satisfied with your sexual relationship together and that you're both on the same page. You might be asking, why should we talk more? It is the best way to enhance sexual satisfaction after having treatment. Sharing your thoughts and feelings can help both of you to process any changes. We like to say that bladder cancer is a couple's disease because bladder cancer treatment can affect the partner just as much as the person with the cancer. This is why it's important to ask your partner how they're feeling. We often think that we know someone so well that we can read their mind, but this isn't true, and it's important not to assume your partner feels a certain way. So how do we communicate better? You can take some time to think about what's important to you and what's important to your partner. Also take some time to discuss both of your thoughts. Pay attention to your partner's responses and acknowledge their feelings. If you don't feel comfortable talking about it out loud, it might be helpful to write a letter or to write some notes. Or you can always see a counselor or sex therapist, someone who's trained to open up the conversation and make it easier to talk about. Here is the intimacy diagram we saw earlier in the presentation to remind you that there are many ways to connect with your partner. It may feel natural to put all of the focus on the sexual type of intimacy, especially if erections are not working post-treatment, but it's important to look at all the dimensions of intimacy. There are many ways to enjoy being close with your partner. And many couples have shared with us that their other dimensions of intimacy have actually improved as they've gone through the cancer experience together. So most of this has been focused on partner relationships, but being sexually active and feeling attractive is just as important if you're single. The same treatments and resources are available for single patients, whether you want to be able to masturbate, have sex, or start a new relationship. All of this information applies, and we highly encourage single patients to come to our clinic as well. If you are starting a new relationship, we know it can be challenging to share your cancer experience. We find that being honest and keeping it simple is important. Bladder cancer treatment, as we've reviewed, can cause changes in your sexual life and requires adaptation. The process can be complex and warrants the need to apply the principles of acceptance, flexibility, patience, and persistence. Acceptance is understanding the sexual consequences of treatment. Why has it happened? But more importantly, how you're coping with it. It can also include grieving the loss, moving forward with new ways of being sexual, as well as redefining your sexual self-view. Flexibility is about having an open mind, being able to reflect on your beliefs, values, and behaviors, and making adjustments as necessary. Patience and persistence are also important since it takes a long time for your body to heal and to master new ways of being sexual. Adapting sexually can mean both optimizing sexually and working on penile health. Sexual optimization begins with an awareness of the potential for sexual difficulties following any disruption in health. When you start to sexually optimize, you can focus on gaining knowledge about sexuality and how to cope with difficulties, communication with a partner, how to manage feelings of sexual inadequacy and masculinity, understanding how societal myths affect your sexuality, adjusting values and beliefs to enhance your sexuality, and discovering new ways of supporting your sexual health and goals. Penile optimization focuses on the health of the erectile tissue. It's the idea that if you can continue to stimulate and bring blood to the penile tissue with or without a partner, you'll have a better foundation for erectile function improvement. Remember when we discussed those nocturnal erections, the penis's way of naturally working out? When you don't have that natural workout, you may need to be intentional about doing this yourself to keep the penis healthy. Penile tissue can become fibrotic over time if it's not used. You can think of it like other muscles in the body. If we don't use the muscles, they can become deconditioned. It's the same thing with the penis. It needs to be working out to stay healthy. There are various ways of engaging in penile optimization. So there's penile massage, there's oral medication, there's injections, and vacuum therapy. Whatever generates the most engorgement will be the most effective form of exercise. Your treatment and recovery will determine when you can start these different interventions. Talk to your doctor about when it's safe to do so. We recommend doing penile optimization for a minimum of 2 to 3 times per week and continuing to do this until spontaneous erections return. Remember, this can take time. With surgery, for example, it can be several years before the cavernosal nerves heal. Now we'll talk about enhancing erections for sexual intimacy. The options are essentially the same. You've got the oral medications, the intraurethral medication, penile injections, and the vacuum pump, and the penile implant. So we'll talk about each of these in more detail. The oral therapies, or pills, inhibit an enzyme called phosphodiesterase 5. This enzyme is present in cells lining the smooth muscle tissue in the penis. When we inhibit this enzyme, it causes the smooth muscle to relax and allows blood to flow into the penis to help create an erection. The first thing people will usually try are the pills because they are considered one of the easier and least invasive therapies. They all work similarly because they are the same type of drug. However, some people respond better to one than another, or you might have side effects with one and not another. So it's good to try all of them at different times to see which one is the most effective for you. Something to consider is if you use a nitro spray or take blood pressure medication or have low blood pressure, then these pills may not be appropriate for you. Always talk to your doctor before taking these medications. Also consider your nerve function and level of testosterone. If your erectile nerves are still healing or they've been removed, the pills might not be effective. If you have low testosterone, the PDE5 inhibitors may also not be effective as they rely on testosterone to work. However, with that being said, we have had patients with low testosterone or who had no nerves spared during their surgery that have responded to the pills, so it doesn't hurt to try. Some of the PDE5 inhibitors are short-acting and one of them is long-acting. The short-acting ones are Viagra, Levitra, and Saxon. They're in the system for up to 8 hours. The long-acting one is Cialis, and Cialis can stay in your body for up to 36 hours. It's really important to know that you need to have good sexual thoughts and stimulation after taking the pills. Potential side effects include indigestion, facial flushing, nasal congestion, headaches, blurry vision with Viagra, or muscle cramping with Cialis. Viagra and Levitra are significantly affected by fatty foods and alcohol, so take these on an empty stomach or wait at least 2 hours after completing a meal. Next, we've got Muse. Muse stands for Medicated Urethral System for Erections. Originally, Muse was a tiny pellet or suppository about the size of a grain of rice, which was administered into the urethra, which is the same place where a urinary catheter would go, and this was done using an applicator. It looked as though it might be uncomfortable, but it was actually quite well tolerated. Currently, the pellet is not available in Canada, but a gel version is available. Whether it's the pellet or the gel, neither are commonly used in Canada because they are quite expensive, about $40 to $70 per dose, if not covered by insurance, and works in about 40% of patients. Muse can give a good quality erection within about 10 to 15 minutes if it does work, but it's not appropriate for everyone. If you have urinary incontinence, for example, the medication may not be absorbed properly. Side effects can include irritation to your urethra and your partner's vagina or rectum if you're having penetrative sexual activity. Next is penile injections. Penile injections are one of the most effective ED treatments, about 90% effective, and one of the most affordable therapies. Penile injections are not reliant on erectile nerve function or testosterone to be effective. It is a local response that's created where you inject a small amount of medication, and this is injected into one side of the penis. The medication causes the smooth muscle in the penis to relax, allowing more blood to flow in and forming an erection. The erection will develop within 5 to 20 minutes, and it typically lasts 30 to 60 minutes. A lot of people are hesitant to try penile injections because they are worried it will be painful, and a lot of people don't like needles. It is a very small needle, and most people do not really feel the needle being inserted if the technique is done correctly. So the most challenging part of the injections is the psychological aspect and being comfortable with the injection technique. In our clinic, we do one-on-one teaching for penile injections. We would discuss how the medication works, how to draw up the medication, different ways to hold the penis, and how to actually perform the injection and how to adjust the dose. There are some possible risks. Priapism is one of the risks. Priapism is a prolonged erection, and there is also a potential for scarring of the penile tissue. There is a very small risk for both of these. Next, we've got the vacuum erection device. You may have seen some in adult love shops and online. We recommend using a medical-grade vacuum erection device to prevent any damage to the erectile tissue and to ensure it's effective. It's about 80 to 90% effective when used correctly. If you purchase a vacuum pump, we recommend using it daily for the first 14 days. This will allow you to master using the device and help to recondition the penile tissue. The vacuum pump can be used for two purposes. It can be used for exercising the penis, and you can also use it for sexual activities, whether that's for self-stimulation or with a partner. You can also use the vacuum pump with the PDE5 inhibitors, Muse, or the penile injections. How the pump works is that it generates negative pressure, and that negative pressure pulls blood from the veins and arteries into the penis to form an erection. Once you remove the device, the erection will fade. If you want to maintain the erection, you will need to use a tension band. You can only wear the tension band for 30 minutes at once, so do not fall asleep with this on. Some tips. You need to have a good seal, which can be accomplished by using a water-based lubricant and trimming back any pubic hair. There are a few considerations when using the vacuum pump. The erection can look like a dusky blue color, and it may be a bit cool to touch when formed. This is from drawing in blood from the veins, which doesn't normally happen with natural erections. It's not harmful, but it can be distressing if you're not informed. You can use a lubricant and warm the erection in your hands prior to intercourse if this is bothersome for you. When using the vacuum pump and tension band for sexual activities, you may notice a hinge effect. This is because the blood is only maintained until the base of the penis. It does not go deeper into the pelvis the way a natural erection would. So we recommend using a hand to guide the penis at least 50% of the way into whatever opening it's going into before engaging in movement, and you may have to experiment with different positions. Last but not least, we have the penile implant. The penile implant is a permanent procedure. So once you decide to have the implant, you can't go back to using the pills, the injections, the gel, or the vacuum pump. The benefits of the implant is that it takes 10 seconds to form a completely rigid erection. 90% of patients say they are satisfied with their penile implant. It is a 1 to 1.5 hour surgical procedure, and it is covered here in BC if you're under MSP, so it is 100% free of charge. There are different models of implants. The one that's pictured here is a 3-piece device. There is a pump in the scrotal sac, a fluid reservoir in the pelvis, and 2 cylinders which replace the erectile bodies in the penis. Once you've healed, your doctor will show you how to cycle it. Doctors will usually wait until about 2 years post-treatment before discussing the implant to make sure you have achieved the best possible recovery for natural erections first. Something to consider is that the penile implant does not extend the length of the penis by much. So if you lift your penis out away from your body while it's flaccid and apply a bit of stretch, that's about the size it would be when using the implant. So how do you begin? Remember, nothing is a quick fix. It takes time and practice. You can begin by talking to your partner. This can help you deal with the changes. Discuss ways of enhancing intimacy without penetration. There are many ways. Communicate with your partner about what you'd like to see in your sexual relationship together and what feels good for both of you. And you can request an appointment with our Sexual Health Clinic and our clinical counselor. Our hope is that this information is helpful and empowers you as you journey through the sexual adaptation process. We recognize that talking about cancer can be overwhelming. Even watching an education session like this, you are exposed to a lot of information that can create some anxiety or uncertainty. These feelings are normal, and our clinical counselor can help you navigate some of these emotions. So please feel free to request an appointment if needed. Here's the contact information for the Bladder Cancer Supportive Care Program. Feel free to reach out by phone or by email if you want to be connected to any of our services. You can just leave a message, or you can specifically request to talk to our program coordinator if you'd like. Thank you.